Good morning. This is Babak, Larian, here to talk to you today about parotid issues, salivary gland issues as a whole. I think especially important to talk about it now that we have a pandemic, and how do you address issues during this time. And these are obviously very important and very concerning questions that we need to answer. We need to figure out figure out who needs to have treatment now, who can wait until things are a little bit more settled, and medically it's more opportune to go to a physician's office and so on and so forth. In any case, so I'm going to turn around and show you the slides, okay? So let's look at salivary gland tumors, because that's the most common thing that needs to be addressed. Fortunately, in the parotid gland, only 20% of what we see is cancerous, right? 80% is benign. And so most of the tumors that occur in the parotid gland, the biggest salivary gland, are benign in nature, right? And majority of tumors happen in the parotid gland, majority of tumors in the salivary. Many tumors happen in the submandibular and even less in the minor glands, but the potential of cancer increases in those other glands. And the parotid, the potential for cancer is small, fortunately. There's 15 different types of tumors, benign tumors that happen in the salivary gland, pleomorphic adenoma being the most common, and there's 20 different kinds of epithelial cancers, meaning non-lymphoma, non-sarcoma type cancers that occur. Mucoepidermoid being the most common, followed by adenocystic and adenocarcinoma, and then pleomorphic adenoma that has transformed into a cancer. So overall, 68% of tumors that happen in the parotid gland are pleomorphic adenomas, and that's meaningful. Because there's many different types of cells in the salivary gland, many different types of tumors can occur. That's why there's so many different types. And under the microscope, you can see a normal salivary gland, and you can see the cells that produce the saliva and put it into a duct. So this is the duct. These are the cells that produce the saliva and then secrete it into the duct, and from the duct it comes out. And you can see things are very organized in a benign, normal salivary gland and very disorganized in a tumor. In any case, so obviously doing a needle biopsy at this point in time is absolutely crucial for someone who has a tumor, because then it'll categorize the tumor into benign or cancerous, and that helps you decide the urgency of what you need to do. If you have a lump and you need to do something about it, if it's been there and now concerns you and worries you, if you do a needle biopsy, then you'll know what that bump is, and then you know how appropriate to address it. Should you take action right away? Should you see a surgeon and immediately within a week or two have your surgery? Or no, you have time to figure out what the public response to the virus is, how the healthcare system is responding to it, if you want to expose yourself to the healthcare environment at this point in time under the circumstances. And those are very important questions, right? And so let's turn around again. So besides what it is, the other factors that are important is obviously the size of the tumor and how much it's growing. How rapidly does this small tumor is turning into that? So if it's growing rapidly, obviously you need to take action. Even if you do a needle biopsy and it's benign, if the tumor is growing rapidly, then you need to take action. If the tumor is painful and making you feel discomfort over the face, if you have some weakness of the face, so when you smile, if the side doesn't move like that, then that's an issue. That means the tumor is impinging on the nerve and you need to take action. And so these are important things you need to do in order to figure out what should be done to address a tumor at this point in time. Now, there are other reasons for needing treatment for the parotid and the salivary glands. There's chronic inflammation, chronic swelling, or acute inflammation, or an infection in the gland that's causing an abscess, which is a fluid-filled pocket to form. Now, if you have a salivary gland that just rapidly grows, becomes painful, and the skin over it becomes red and tender to the touch, that's an infected salivary gland, right? And it can happen here, or it can happen under your jaw, behind your bone, under the jaw. And when either one of these happens, you obviously need treatment. The most important thing to do is to call and contact your doctor to get antibiotics, but also to put warm compresses on these areas and massage in a forward direction, right? To get the saliva or the pus that's collecting in the salivary gland to secrete the pus out, so it's not sitting in there. You're expressing it out, right? And thereby helping your immune system fight the infection better, because the infection is not sitting in the gland. So when it comes to that, then obviously taking action is important, right? Now, in terms of the benign tumors of the salivary gland, they fall into two categories, right? Benign tumors that are always going to stay benign, right? And benign tumors that have the potential of becoming cancers, right? Pleomorphic adenoma, unfortunately, the most common type of tumor in the parotid gland, has the potential of becoming a cancer, and so therefore needs to be removed. Now, it may not need to be removed immediately, right? That's based on its growth rate. If it's growing rapidly, then it should be taken out sooner. If it's growing slowly, then you can take your time to figure out how the pandemic is moving forward and how it fits into the risk category that you fit in, and if it's appropriate time for you to address it, right? And a lot of things factor into it. Obviously, the growth rate factors into it, and the amount of stress and anxiety this is producing for you, right? So if you are feeling that this is putting an undue burden on you, that also affects your immune system. That also affects how your general state is, and that may be a reason to take action, right? Again, you're trying to do everything you can to stay as healthy as possible, and every one of these factors are important. But if you're calm, cool, and collected about it, and you can stay that way, it's not eating you up and it's not keeping you up at night, then it's possible to take your time and be measured in the way you react to it, okay? And so, again, the needle biopsy is very important to categorize you and help you figure out which direction to take with these things. So let me bring up some of the questions that have come in. Question comes in actually from another country. 11-year-old who had a tumor in the parotid gland, underwent surgery, and lo and behold, they found that it was actually a cancer, a low-grade mucoepidermoid carcinoma. On the pathology report, it reads that the margins are negative, so the tumor had not reached the edges of the specimen. That's important, because let me show you. I'm gonna flip you around. All right. So let's say this is the tumor that's developing in the parotid gland. Okay, and let's say that we're gonna have to do some technical things here. Bear with me. There you go. So if the surgery's done, and during surgery they see that this mass is not soft, it's harder, and they're concerned for it to be more than a benign tumor, especially if a needle biopsy was done and didn't show it or was not clear, then what you're doing is you're not only taking in the tumor, but you're going to get a margin of normal parotid gland. Only because you don't know if this tumor has tiny little legs that are not visible, right? So you get a margin, a centimeter in all directions, especially in places that the nerve branches allow you to, right? So if the nerve branch is going like this, right, and if this one these are examples, not reality, but if that's the case, then you have the luxury of going right to the nerve and getting margins in all. So in this particular patient, they did the surgery, they took it out, and the margins were negative, which meant that when they examined the edges, when they biopsied, let's do this in blue, when they looked at the edges of the tumor that was removed under the microscope, or the specimen that was removed, there was no tumor at the edge, which they say are negative margins. And when you have negative margins like that, then in a low-grade cancer, like a low-grade mucoepidermal carcinoma or a cynic cell carcinoma, you can safely say that the surgery was successful and the treatment for this particular cancer is completed. You don't need to do more than that. Fortunately, you don't need radiation. You don't need chemotherapy. And so I feel like your son has had a very good treatment, fortunately, and is no longer in need of any further types of treatment. Congratulations. I'm very happy for you. All right, let's move on to the next question. Sydney, Montana. What are the natural ways to help parotid inflammation? Parotid inflammation occurs. Let me show you. Let me flip you around. So, salivary glands. Let's try this again. So salivary glands produce saliva, right? That comes through the ducts into the mouth, right? So the saliva in all of this gland, through various ducts that come together, all come through and then go through the duct to come out of the mouth, right? So if there's anything blocking the duct, right? So if there's inflammation in the gland, if there was an infection, then the saliva that would be in there can't get out and would stay in the gland. And that would cause the gland to, over time, swell up because the saliva is backing up into it, right? And when the saliva backs into the gland, it swells up and becomes uncomfortable. Majority of times when the saliva gland is swollen, it's because of that. But usually that's a one-sided thing, right? It's only on one side that you get that. If you're getting it on both sides, then that means there's more issues going on. An autoimmune disorder called Sjogren's syndrome, where your immune system attacks the salivary glands, causes both sides. A lot of times, the poor patients who have body image issues and end up falling into eating disorders, right? Or for a variety of reasons, may fall into an eating disorder. When they have bulimia, where they eat and then they purge or they vomit after they eat, constant exposure of the mouth to the acid from the stomach can cause the acid to go through the ducts and into the gland and cause the glands to become inflamed, swollen, and then cause scarring in the duct that narrows the ducts down, and then saliva can't get through. So those are other reasons. There are times when these glands swell up and we don't know the exact cause of it, right? Not that there isn't one, we just are not clear on what the cause is. And again, the consequence is the same, getting too enlarged saliva glands. The first thing to do to treat these is to drink lots of water to make the saliva thinner so it's not gelatinous and harder to come through the ducts. So lots of water, massaging again in a forward direction to push the thickened saliva out so the normal saliva has a path of coming out, and doing it for on a regular basis for months and months. If that's not working, using anti-inflammatories, natural anti-inflammatories like turmeric and other types of anti-inflammatories out there, to see if you can improve the inflammation in the gland and let the ducts open up and things secrete. There is no sure-shot way of decreasing the swelling that's permanent when there's a chronic underlying problem that persistently keeps causing the salivary glands to malfunction, right? And so I don't think anti-inflammatories alone, unfortunately, are helpful, because the inflammation majority of times is a consequence of a problem inside the gland as opposed to the reason for the problem. Okay? And so, most of the time the problem in the gland is something that causes the duct to narrow. So let me show you. So if you were to imagine that this is the duct. It comes into the gland and then divides up into multiple ducts, which go on branching out, and so on and so forth, right? If you get an infection in the duct that causes the duct to swell up and narrow, right? And if that narrowing occurs, then the saliva that was trying to get through has a harder time passing, right? So a small amount gets through, but most are backed up here into the duct. And unless this narrowing is addressed, you can use any anti-inflammatory or anything. Once things have narrowed, they're narrow. It's not going to open up. And that's usually the most common ultimate cause on the glands. Stacy article is asking, what about a cyst on the parotid? It gets larger as time passes, but this seems to be infected. Are there ways to treat other than surgery? Biopsy showed fluid-filled and non-cancerous. Doctor referred me to have salivary endoscopy, which I'm waiting for appointment. Is there a hope of treating without surgery? It depends. It really does, Stacey. What it depends on is what I do with my cyst patients is I put a needle in it and I draw the fluid out, and I try to get all the fluid out and see how much time I can buy. If I collapse this thing, right, under sterile conditions, I really sterilize it because I don't want to cause infection to the cyst by putting the needle in, right? So sterilize the area, put the needle in, completely draw out the fluid, and collapse it. If it takes 5 years for this fluid to reaccumulate and get big, then getting a needle in it every 5 years to take it out, I personally would do that over having surgery, right? Especially if you do it with someone who doesn't cause infections, they're cautious and careful, and you're getting good results. So that's one way. Salivary endoscopy has a potential of working if the reason you developed the cyst, and this is not in fact a cyst what you have, what we call a sialocyst, which means that it's due to saliva backing up into the gland and a portion of it just fills with fluid, right? And once you open the duct is narrow like this, right? And this is trying to empty into the duct. Once you stretch the duct open through salivary endoscopy and it opens up, all of this stuff will go through. Then that's an option too. So I think the needle aspiration that you did, if they aspirated lots of fluid out and within a month it filled out, then you know that doing the needle is not going to be a solution for you. If they do the salivary endoscopy and stretch the duct and it empties out and it doesn't come back, then you're good. If on the other hand neither one of those work, the only option you unfortunately have is to do surgery. People who have multiple cysts in both sides of the glands, and that does occur. And sometimes it actually occurs with virus infections. There's HIV infection, for example. You can get cysts in both hands. If that were to be the case, then radiation is an option. You see my trepidation by recommending radiation, because radiation in and of itself for a non-cancerous lesion has problems because it can lead to more tumors developing. And so you got to kind of figure out if it's worthwhile. Now, if you're you know, if you're 80 years old and have lots of medical problems and you have these bothersome cysts that keep coming back, radiation may not be, because radiation takes 15 years, 20 years to cause another tumor to develop. You know, at 80, you figure in my lifespan, maybe 100, maybe not, who knows, right? But it may be worthwhile, instead of exposing yourself to radiation and to surgery and anesthesia and so on and so forth. You kind of have to. But if you're 35 years old, radiation may not be the best option, because you have a long life ahead, and the potential for tumor development is very real, because you have a long life ahead of you. Okay, so those are the options, Stacy. Salam, hi doc. I've been diagnosed by pleomorphic adenoma, 1.5 centimeters, since I don't know if it's growing, but I do not have pain or problem in movement on the same side. I have upper and lower wisdom teeth removed 3 years ago. So my question is, should I wait to get it removed as it is small? Kindly advise, appreciate your help. Very good question. You know, I tell my patients who are younger, and by younger mean, you know, 60 and 70 years old or less, that because they have a long life ahead of them, they should have it removed, right? The chance of this tumor transforming into a cancer is 10% at 15 years. So once it's been there 15 years, there's a 10% chance that it can turn into a cancer, and when it does, it turns into an aggressive cancer, right? So the younger you are, the more lifetime you have ahead of you, the more opportunity for exposure to toxins in the environment from smog and whatever is in our food and water, so on, and that can cause the transformation of the pleomorphic adenoma into a cancer. So when you're young, I'd say definitely, and young, again, less than 70 years old, I call young, I suggest that you do surgery at some point, okay? Now, it doesn't have to be next week or next month, right? You know, generally, I tell my pleomorphic adenoma patients who haven't had rapid growth of the tumor, it's been there for a while, it's not causing any symptoms, I say, you know what, you should have a 3 to 6 month window of having time to take care of it. It would be a good idea to do it within that time frame, all right? But definitely do it. Now, if you have multiple medical problems, you have kidney failure and heart problems and liver failure and so on and so forth, then this obviously takes a back burner until those things are addressed. And if those are optimized and everything's back to normal, then you can take care of it, okay? So it's not a number one priority, but it is something to keep in mind. All right, let's see what other questions are out there. Oh, is asking if the wisdom teeth removal had in any way anything to do with this. Fortunately and unfortunately not. That would not cause these tumors. These tumors are caused by mutations in a single cell in a parotid gland. So a single cell, let me flip you around and explain. So, you know, a parotid gland is made up of millions and millions of cells, right? If a single cell in there, let's see, we'll do it in green. If a single cell in here gets a mutation, and then that mutation is in a gene that controls its growth rate, it'll continue to grow, duplicate, one cell becomes 2 cells become 4 cells, right? And they grow and grow and grow and grow, right? And the growth rate doubles, right? So 2 cells become 4 become 8 becomes 16 becomes 32, you know, it's a logarithmic thing. So the growth rate always is faster and faster as time goes by, right? And so this is caused by a mutation in that single cell, right? That one cell in here that got that mutation that knocked off a control gene, and so that's why it's growing. So it's not caused by wisdom tooth removal. It's caused more by environmental toxins and poisons that we're exposed to. Okay. In any case, I hope this session was helpful. I'm glad to hear from friends from overseas. to answer questions that you may have, and hopefully this helps guide and direct you a little bit so you can better address your issues during these times. This is Babak Larian again. It's always a pleasure to be here and try to help you guys out, and you know, to help people who have diseases in the parotid gland, an area that I really actually enjoy addressing and treating. Take good care, be safe, bye.